So antifungals are for some of the mycoses, or the fungal infections. Most of them are superficial, like with oral candidiasis or vaginal candidiasis. Some can be systemic, and those are quite severe in the lungs, the CNS, and the abdomen. Antifungals are used typically on opportunistic infections like candidiasis, aspergillosis, cryptococcosis, and mucormycosis. Usually these occur in immunocompromised patients. There are some non-opportunistic infections like sporotrichosis, blastomycosis, histoplasmosis, and coccidiomycosis that can occur. Those are usually pretty serious too. Antifungal groups, these are different types of antifungals or antimycotic drugs. There can be polyenes like amphotericin B and nystatin. The azoles, which are rightfully named like ketoconazole. The antimetabolic, the antiprotozoles, and the echinocandins. The ones that we focus on really are the polyenes and the azoles. Amphotericin B treats severe fungal infections. It binds to the fungal cell membrane, causing leakage of cellular contents. Side effects of polyenes include fever, chills, headache, dyspnea, hypotension, hypertension, tachycardia, GI distress, pseudomembranous colitis, seizures, paresthesia, thrombophlebitis, and high doses can cause nephrotoxicity, electrolyte imbalances, and ototoxicity. I have seen seizures in someone receiving amphotericin B at the U. So it's fungistatic or fungicidal. Give it very slowly. Monitor vital signs frequently. Says here 30 minutes, but usually more often than that when it's being given IV. Prevent febrile reactions and anaphylaxis. Increase fluids, monitor urine output and weight, monitor electrolytes, renal and liver functions. Then nystatin or mycostatin is probably the most common that we'll all see. This is a polyene. So methods of administration include oral and topical. It increases permeability of the fungal cell membrane. So it's fungistatic and fungicidal. So it slows down their growth, plus it kills them. So patient teaching, we want to let them know, usually it's a swish and swallow. So gargle if the throat is affected. Sometimes, every once in a while, it'll be a swish and spit. But usually it's a swish and swallow. Again, the azoles are ketoconazole, fluconazole, itraconazole, and they treat coccidioidomycosis, tryptococcosis, histoplasmosis, and paracoccidioidomycosis. They can be given oral, IV, vaginal, topical. The ketoconazole you may have seen come in a shampoo. So, and some of the azoles you may have seen come in creams. When you treat people with IV antifungals, usually they're really sick. They're at the U. But many people will get topical. And so you'll be probably using these antifungals, both the polyenes and the azoles, throughout your career.